a boy. He's 18-month old. He's Ronnie. He has non-retractable foreskin. Now mother is Lisa. Mother insists of circumcisions. Now you have to tell about this. It is a what the scenario. Okay. What the means why reissue drawbacks alternative red flags you tell. Clear?
Okay, so this is a non-retractable foreskins,
Foreskin.
and other one to
Hmm.
do the circumcisions.
Then that's why mother want to insist for circumcision. Now you to tell that about this.
Okay, can I start now?
Yeah, you can start.
Hello, good afternoon.
Good afternoon.
I am Dr. Teresa, one of the child doctor. I believe I am talking to Mrs. Lisa, moms of Rooney.
Yeah, I'm Lisa.
Thank you for coming to see me. So I'm here today because I want to discuss about Rooney's conditions. Is that okay for you, mom?
Yeah, that's okay.
All right. Would you like anyone to join with us today, Lisa?
No, today I'm alone. You can talk with me.
Okay. So before we start our discussions, do you have any concerns or would you like me to know for?
Yeah, I have a concern. Doctor, my child Ronnie, he has non-retractile foreskin, and I want to do the circumcisions. That's why, because I don't want that it can be adult life create problems. So I want that.
Yeah, it's look like you are very kind and caring mom for the Rooney. And you look like you are having lots of knowledge regarding the medicine. But before that, do you know how far do you know about these accusations?
I don't know any idea, but actually I want to do this.
All right. Um, so yeah, so Lisa, I can see that where your concern came from. But to be honest, Rooney is 18 months old, and sometime in that children's, it is quite normal, to witness such kind of non-retractable foreskins. But over time, with age, these tend to go away, and we don't need any surgery for that. Are you with me so far?
Yeah, I want to know that, but I would like to do this.
Mm-hmm. Is there any specific reasons that you want to try for that?
Yeah, because I already told you now. I just told you because it may can be affect his adult life, as I told you.
Mm-hmm. What problem would you expect in the adult life if we could not do that surgery for Rooney?
I don't know what's the problem, doctor. I'm telling again and again. I need the circumcision. Why you are not doing that? What is problem with circumcision? Anything wrong?
Mm.
Any harm in circumcision?
Okay, Lisa, I can see that. I'm really sorry that actually we don't normally do the circumcisions if it is not essential or required for the child, because you know what, doing the surgeries has its own drawbacks. Sometimes the child needs a lot of injections which is painful, and sometimes the child after the surgery the child may have painful and problem can happen with pee because of the pain. So that's why we normally do not suggest for the child to have these circumcisions without absolute indication for that. So
Okay.
non-rechargeable skin is not an absolute indications to go for that surgery.
But
Are you with me? Am I clear for you?
yeah, you are clear to me. But I want to tell you one information that every day you guys are, for religious reasons, you are doing this, right? But in my child, why not?
Okay, so in the NHS, we normally do not go for the this circumcision for the religious purpose. We do the circumcisions only to the child who require this surgery. For example, the child who has frequent history of PE jams in the PE, and they require the surgeries, and then we do for that. We goes for that. Um, and sometimes it is better as we wait and see, because the child's as I told you, the surgery after the surgeries the pain can be terrible, and the child can have a problem with pee later, so we don't want that to happen to Rooney.
Okay, okay. I understand why you are not interested because we are Asian, right?
I'm sorry you feel like this way. It's not about the Asians or Caucasians, and we don't have any forms of discriminations to our patients. I'm really sorry you think that way. But I can tell you, I can give you the website about the surgeries and also our guideline if you want to see that, so that you will be clear about our decisions or why we do not suggest that surgery. How does that sound to you?
Yes, sound, but doctor, I have covered my insurance. But why you don't understand that? Why?
Mm-hmm. It's not about actually many other reasons, Lisa. It's about we don't want unnecessary struggle or stress happen to the Rooney, because you know what? None Rooney does not currently have any pain, isn't it? Rooney can go to the pee without having any problem. Doesn't have any problem with frequent pee infections. So Rooney is quite happy child. And why do we need to put the stress, unnecessary stress that he doesn't require?
Okay. Okay, then I am going another hospitals. I understand that.
Actually, Lisa, every hospitals will have the same decisions like us, because we have this similar protocols, national protocols, to whom we should do that surgeries for that. I'm really afraid that even though you go to the others hospital, they will probably give you the same suggestions.
Okay, then I will complain.
All right, Lisa. I really respect your opinions, and but let me tell you one thing, that Lisa, if you have noticed that Rooney's have problems with frequent history of pee infections, or you have noticed that the skins around this tip of the penis has been very swollen and red and painful, in that case, please do come and see us. We will probably arrange surgery at that time. But right now, what I can give you, I can give you the suggestions. Which are you happy to listen for that?
Okay, okay.
Okay, my suggestion is that do not forcefully retract if it is not possible to do it so. And you can clean or wipe the tip of the areas with a cotton bud, and do not use a strong soaps. Um, is that clear for you, mom?
Yeah, is that clear?
All right. Do you have any more questions at this stage?
No, I have no any questions.
All right. Thank you so much for your understanding. How about I give you a leaflet and website about the circumcision, so that you have an idea as why we don't suggest for that for Rooney.
Okay.
Okay. Uh, can I summarize what I have explained to you so far, just to make sure
Yeah,
you we are on the same page?
yeah, yeah.
Okay, so we have a discussions regarding why Rooney does not need the surgical circumcisions at the moment. Rooney is quite happy, shy, and doesn't have any problems with going to the pee. However, Rooney, you have noticed that Rooney is the skin is not retractable, and we need to wait for that, and we will see that whether there is any problem happen due to that. If there isn't any problems, and it will goes away, it will goes on by its own. um do you have
Okay.
any more questions, Lisa?
No.
Okay, thank you so much for your time.
Okay. So you have completed also time is over, but I want to tell you in this communications you have given some wrong informations. Okay. I'm telling you
Yeah.
how can we do that. First of
Mhm.
all, she wants to do the circumcisions. May I know why
Oh,
you are worried? Because yes, doctor, it will affect his adult life later on, and I'm really sorry. I'm really worried. I would like to do it to my child. I totally understand your feelings, but let me reassure you that this is one of the normal variants before the age of 2 years. By the age of 2 years, it will improve. If it didn't improve, we can use some steroid cream. So it will be improved after 2 years. If not improve, we are giving that steroid cream. But I'd like to do it. Is there any other concern? No, I just told you it may affect the adult life, as I told you. Now but I'm telling you, ma'am, it is normal variant and it will not affect the adult life. Okay. So now, ma'am, mom is very much angry. She's telling why you are not doing that. The answer is like that. Actually, circumcision is considered a surgery, and it is have some drawbacks. For example, because he is old now, 18 months, he may need general anesthesia, and this general anesthesia itself has many drawbacks. It may affect his breathing and it can be risky. Also, he may suffer from pain. Adding to this, there is a risk of bleeding. Am I clear? Okay. Added to this, there is a risk of catching bugs, although we will do our best to help him and prevent these drawbacks, but still risks are present. So one thing you need to tell, there is pain, lots of injection. Actually, it is not the main reason. Main reason is that it is needed, it is a surgery and needed general anesthesia, which is really risky. Really, it causes drawbacks. It may affect the breathing. In my country, that is like a horrible. Go the circumcisions, lots of accident occurred. They do under general anesthesia, and the child died. That's happened and truly happened in my
Okay.
country. Okay, now I'm telling,
Mm.
okay, doctor, but you do it every day for religious reasons. Why you are not doing it to my child? Yes, we do it for religious cause, and even still has these drawbacks. If these drawbacks remain, still we are doing this religious purpose. You are telling that NHS has not doing that. Is that true? NHS not doing? No. If religious purpose, we can do that if it has these drawbacks. But
Really?
non-retractile foreskin is not an indications. Okay.
That really, doctor? Do they do the religious purpose circumcision in NHS?
And here written it. Yes, we do it for religious cause, and even still
Mm.
has these drawbacks.
Okay.
Written the sheet. Okay, you are doing this because we are Asians, but you can ask on the group. We can ask that is that any change occur or not? The circumcision religious purpose. You can give the permission or not. We need to clear that. So I'm telling that yes, we are Asian. That's why the answer is that actually no. We are treating all our patients equally, regardless their ethnic group, regardless their age, and regardless their religion. We are searching for what is the better of your child. So we cover insurance. I do not understand why you do not want to do that. So about money, I totally understand this, and this is not matter of the money or problem. It is the about best interest of child. Okay, so best interest of child, we are doing that. Then I can go another hospital. The answer is that I can understand what you are talking about, but every hospital will do the same because it is what is the best interest of the child. So best interest of the child is one of the law. We know that we can mention that. I will complain then, ma'am. We are trying the best of your child. Again complain. Then you will guide about the false. Now some red flags always information like functional constipation, functional abdominal pain, headache. We are giving some red flags here also red flags. These are only if there is a foul smelling odor, greenish discharge, and redness in the private area, you can seek medical advice immediately. Then trusted website leaflet supporting group. Okay?
All right.
Okay, then we
Thank
are
you.
going